From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
Welcome to this week's News Roundup. I'm Jennifer Abbasi, Director of JAMA Medical News. On today's show, we're discussing the launch of the Governor's Public Health Alliance, an initiative to bolster disease detection and response amid U.S. federal funding cuts. Associate Managing Editor Kate Schweitzer is here to tell us about the coalition. Kate, thanks for joining.
Thanks, Jen.
So tell us, what is this new alliance and why is it being formed now?
Well, simply put, it's the latest attempt at creating an alternative public health network that would operate outside the federal government. It launched in mid-October with 15 state and territorial leaders on board. In addition to states on the West Coast and the Northeast, the alliance includes Colorado, Illinois, Hawaii, and Guam. Its goal is to serve as a potential stopgap to funding cuts happening across federal agencies, including the CDC. It's also poised to provide some cohesion in response to the often controversial changes in guidance coming out of the U.S. Department of Health and Human Services, particularly around vaccine policy. I spoke with Hawaii Governor Josh Green, who's also a physician and one of the first to join the alliance, and he said it stands to deliver clear, consistent, science-based guidance to the public.
So how do proponents of the Governor's Public Health Alliance see it functioning?
So take vaccines, for example. The federal government historically handles vaccine approvals and recommendations, but states hold primary authority for mandating vaccines, such as first school entry. Even before this alliance formed, states began taking action to insulate their constituents from some constraints surrounding potential changes to COVID-19 vaccine eligibility, access, and insurance coverage. So what the alliance offers is, instead of having 50 different regulatory approaches to vaccines, it can provide some coordination and collaboration across entire regions. Experts also spoke about how the alliance could help mitigate outbreaks across state lines and globally. Take New York, California, and Illinois, all hubs with international airports. Following the announcement of the U.S.'s withdrawal from the World Health Organization, the alliance could maintain a single link to the global health community instead of reinventing the wheel state by state. It's worth noting that although the alliance is advised by a group of bipartisan public health experts, it's currently made up of all Democratic governors. So this is sure to present some challenges.
Yes, political polarization for starters. So Kate, can you walk us through the hurdles the alliance may face?
Certainly. It almost goes without saying that this alliance is a reflection of an increasingly partisan approach to every aspect of governing. Without the inclusion of red states and Republican governors, my experts warned it's likely that any goals around depoliticizing public health will fail. In fact, that's a very real concern that this approach becomes the new playbook, no matter the administration. It's easy to imagine a Democratic president making certain changes to federal recommendations about public health and then Republican-led states joining together to push back against them. And adding to the divide is the fact that the Governor's Public Health Alliance is one of several newly formed public health alliances. There's a West Coast Health Alliance and a Northeast Public Health Collaborative. Although those behind these initiatives believe they will lift up one another's work, it could result in duplicative efforts. And although every public health expert I interviewed emphasized how this alliance should be temporary, that there's no replicating the CDC or its systems, we might be primed for a fundamental restructuring of how public health is organized in the U.S. As one public health expert told me, if we had a blank sheet of paper, we would design something very different than the health system we have now, one with enormous costs and poor health outcomes that crowds the ability of governors to deal with anything else.
Thank you, Kate. All right, if you'd like to learn more, we'll include a link to Kate's story in the show description. This week, we also have my interview with the co-chair of the recent Kidney Week conference about clinical research highlights from the annual meeting. That interview is available in this show's feed. And you can find all of our stories at jamamedicalnews.com. Thanks to Kate Schweitzer for joining me. I'm Jennifer Abbasi for JAMA Medical News. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.